Have you ever looked at your paycheck and wondered where a huge chunk of it went? For millions of Americans, the answer is health insurance. We're talking about an average of $500 a month, sometimes even more. It feels like a second rent payment, doesn't it? So, why is American healthcare so ridiculously expensive? Is there some secret reason we're all paying so much? Well, today we're going to pull back the curtain and uncover the shocking truth. This isn't just about numbers. It's about understanding the system that impacts our wallets and our well-being. Stick around, because what you're about to hear might just change how you see your healthcare bill forever. First, let's get one thing straight. There isn't a single villain in this story. It's a complex web of factors that have been building for decades. One of the biggest culprits is the sheer lack of price transparency. Think about it. When you buy a coffee, you know the price. When you shop for a car, you can compare prices online. But when you go to a hospital for a procedure, can you easily find out how much it will cost? Nope. You often get a massive, confusing bill weeks later. This opacity allows hospitals and clinics to set their own prices, and these prices can vary wildly from one place to another for the exact same service. It's like shopping in a supermarket where none of the items have price tags, and you only find out the cost after you've eaten the food. Now let's talk about the players involved. You have the insurance companies, the hospitals, the pharmaceutical companies, and the government. Each one plays a part. Insurance companies are for-profit businesses. Their goal is to make money. They do this by collecting more in premiums than they pay out in claims. They negotiate rates with hospitals, but these negotiations are often secret. Hospitals, on the other hand, have their own massive costs, from state-of-the-art equipment and administrative staff to malpractice insurance. To cover these costs and make a profit, they create something called a charge master, which is essentially a master list of prices for every single service and supply. These prices are often inflated, sometimes by as much as 10 times the actual cost. This is the starting point for negotiations with insurance companies, who then get a discount. But if you're uninsured, you could be billed that full inflated amount. Then we have the pharmaceutical industry. The US is unique because it allows drug companies to set their own prices with very little regulation. In many other countries, the government negotiates drug prices on behalf of all its citizens, driving the costs down. But in America, a complex system of patents and market exclusivity allows drug makers to charge astronomical prices for life-saving medications. We've all heard stories of drugs that cost a few dollars to produce being sold for hundreds or even thousands. That cost doesn't just disappear. It gets passed on to you through your insurance premiums and copays. The argument is that these high prices fund research and development for new drugs. But critics argue that a huge portion goes to marketing and profits. So, you have hospitals charging high prices, drug companies setting sky-high rates, and insurance companies acting as the middlemen, all while trying to make a profit. It's a perfect storm for expensive healthcare. But there's another piece to this puzzle: the way most Americans get their insurance. Most people get it through their employer. This system started during World War II as a way for employers to attract workers when wage freezes were in effect. It sounds good, but it ties your health security to your job. If you lose your job, you often lose your insurance. It also means you have limited choices. You get the plan your employer picks, not necessarily the one that's best for you. This employer-based system also hides the true cost. Your employer might be paying a large portion of your premium, but that's still money that could have gone into your salary. So that $500 you see coming out of your paycheck might only be part of the total $1,500 monthly cost of your plan. Let's dive a little deeper into the administrative side of things. The American healthcare system is incredibly complex to navigate. A single hospital visit can generate paperwork for the hospital, the doctor, the anesthesiologist, and the lab, all of which might be billed separately. Insurance companies then have to process all these claims. This creates a massive administrative burden. It's estimated that about a quarter of all healthcare spending in the US goes to administrative costs. That's billions of dollars spent not on patient care, but on paperwork, billing, and bureaucracy. In countries with simpler single-payer systems, these administrative costs are significantly lower. Think about all the people whose job it is to just argue with insurance companies all day. That's a huge, expensive part of the system we're all paying for. Another factor is our culture of treatment over prevention. The system is largely designed to treat you when you're sick, not to keep you healthy in the first place. While preventative care is becoming more common, the real money is in expensive procedures, chronic disease management, and emergency care. A person with unmanaged diabetes, for example, is far more costly to the system than someone who receives support to maintain a healthy lifestyle. This reactive approach means we often wait until problems are severe and expensive before we address them. Furthermore, we Americans tend to want the newest, most advanced technology and treatments, even if they're only marginally better than older, cheaper options. This demand for cutting-edge care, while understandable, also drives up overall costs for everyone. So what can we even do about this? It feels overwhelming, right? On a personal level, it's about becoming a smarter healthcare consumer. Always ask for price estimates before a procedure. Review your bills carefully for errors, and trust me, they are common.
Bye.
Understand your insurance plan inside and out. Know your deductible, your copay, and your out-of-pocket maximum. Don T. Be afraid to question your doctor about the necessity and cost of a test or treatment. Sometimes, a cheaper, equally effective option is available. Using in-network providers is also crucial to avoid surprise bills. These small steps can save you thousands of dollars. On a larger scale, the debate about healthcare reform is ongoing. There are many proposed solutions, from a public option that would compete with private insurance, to strengthening regulations on drug prices, to moving towards a single-payer system like many other developed nations. Each of these ideas has its own pros and cons, and the political will to enact major change is often the biggest hurdle. But the conversation is happening, and it's more important than ever. The more we understand the root causes of these high costs, the better equipped we are to advocate for a system that is more affordable, transparent, and effective for everyone. It's not about politics, it's about our health and our financial future. In the end, that $500 monthly bill is a symptom of a much larger, more complicated disease within our healthcare system. It's a result of opaque pricing, a profit-driven industry, massive administrative waste, and a focus on treatment rather than prevention. It's a uniquely American problem that leaves millions of people just one medical emergency away from financial ruin, even with insurance. Understanding these truths is the first step toward demanding and creating change. We have to keep asking the hard questions and pushing for a system that prioritizes people over profits. Thank you so much for joining me on this deep dive. I know it's a lot to take in, but it's a conversation we need to have. If you found this video helpful or eye-opening, please give it a thumbs up and share it with someone who might also be wondering where all their money is going. And do not forget to subscribe and hit that notification bell so you do not miss our next video. What are your experiences with healthcare costs? Let me know in the comments below. Let's keep this important conversation going. Thanks for watching, and I'll see you in the next one.